endometriosis. More than 1 in 10 women suffer from the condition in the U.S. That's according to the Cleveland Clinic. It's a condition where tissue similar to the lining of the uterus grows outside of the uterus. It's chronic and painful and often goes undiagnosed. It can also lead to miscarriages and infertility. Reporter Priscilla Casper from our NBC Boston affiliate spoke to one woman who struggled with infertility for years before finally getting this diagnosis.
I feel like I ignored a lot of symptoms.
Heavy, painful periods, pins and needles running down her legs, and intense migraines. Just some of the symptoms Lauren Kaczynski experienced for years that she thought were normal.
I saw a TikTok about endometriosis. It was the first time I had ever heard of it. And I remember watching it and thinking like, oh, you know, it sounds kind of familiar, but that can't be me. There's no way that that's me.
After 4 years of infertility, she got a lot of tests and saw Dr. Peter Mavilla at Newton Wellesley Hospital. She had stage 4 endometriosis, the most severe stage.
So we think it negatively impacts things like implantation, leading to people having difficulty getting pregnant, and that also can lead to higher rates of miscarriage.
Dr. Mavilla says he meets regularly to collaborate with surgeons and radiologists like Mass General Hospital's Dr. Anu Shenoy Bengal to discuss new research and techniques that help each other better diagnose endometriosis and improve surgery.
She went above and beyond to not only search the literature about what's been done before, to help create new, more advanced protocols to help diagnose this disease to a really granular level so that you're not really surprised at surgery of what you're going to get into. We essentially have a la carte surgery, meaning that we do excisional surgery where we cut out the disease.
For Lauren, after a successful endometriosis surgery in February of last year, she got pregnant in August and had a healthy baby girl last month.
Don't stop asking questions until you have an answer. Never did I think, you know, I got my surgery in February of last year, and February of this year we were preparing for my baby shower, and I never thought that that would be a reality for us. So sorry.
And our thanks to Priscilla Casper for that report. The doctors say it's their mission to learn the best way possible to treat endometriosis to help improve fertility. They repeat that you should go to the doctor if you're experiencing any severe pain or symptoms. And I'm joined now by Dr. Lucky Sekhon for more on this. She's a double board certified REI specialist and OBGYN at MRA of New York's fertility clinic. Dr. Sekhon, thanks for being with us this morning. So 11%, that seems like a high number of women to suffer from endometriosis. So why is this so difficult to diagnose?
Well, it takes an average of 7 to 10 years for most women to be diagnosed with endometriosis. And as a fertility expert, I know that up to 25 to 30% of my patients with infertility have an endometriosis diagnosis, and a lot of them just don't know it yet. Many times I'm the first one introducing this term to them. And I think it's because we all too often have traditionally dismissed the pain as normal period pain, and it's often misattributed to other problems that can have overlapping symptoms such as irritable bowel syndrome or recurrent UTIs. And traditional teaching was that you had to do minimally invasive but invasive surgery called laparoscopy in order to get a definitive diagnosis. But we now know we can take a more practical approach, and we can look and pay attention to the combination of symptoms as well as picking it up sometimes on imaging such as a sonogram or pelvic MRI.
About 7 to 10 years to deal with this kind of pain. I understand it's reported to be more painful than menstrual cramps. What should women know about when they should go talk to their doctor and ask about this?
Well, everyone's experience with how they feel pain is different. And if you've been having this chronic severe pain your whole life, many times it's normalized. But if it's a severe enough pain that it's interfering with your ability to attend school or you're missing work, that's never normal and should be investigated. Pain with sex, painful bowel movements, painful urination, even chronic pelvic pain outside of when you're on your period. And often the number one way that this presents is when someone's coming in for an infertility workup. So if you're having trouble conceiving and you have painful periods, that can be a telltale sign.
I know women who have experienced pain and gone to their doctor and been told that it's normal, only to find a different doctor and then find out that it is endometriosis. Is that common, and when should women maybe switch doctors?
Unfortunately, it's extremely common, and my big message to women across the board is never settle. Don't settle for it's just your period, and don't allow people to normalize your experience. Track your pain and symptoms, because going to your doctor with objective data where you've tracked the timing, the severity, and how it's impacting your life can go a long way to getting a diagnosis. And ask your OBGYN, are they comfortable with diagnosing and treating endometriosis? Should you see a specialist, and is there a role for getting specialized imaging?
Good advice there. So before you go, what are some of the risks of endometriosis that's maybe left untreated?
Well, a lot of people might not be aware that it's progressive, and it can worsen. It often does over time, and this can lead to problems like scar tissue formation in the pelvic cavity and, like I said, infertility. It can also affect your mental health, so early intervention and recognizing it early is very important so that you can combat these symptoms, preserve your quality of life, and maybe even preserve your fertility via egg freezing.
Really important information. Dr. Lucky Sekhon, thanks so much for your time this morning. Well, coming up, crypto